Imagine spending your entire life working hard, saving every dollar you could, building a small but meaningful legacy for your children, only to reach the final years of life and realize medical bills are quietly draining everything you hope to leave behind. It happens every single day in the United States, and most families don't even realize it's happening until it's too late. If you want to protect your home, your savings, and the future you've imagined for your loved ones, then stay with me because today I'm going to walk you through something most seniors never learn soon enough: how Medicare and estate planning connect, and how unmanaged medical costs can eat away at the legacy you hope to pass on. My name is the Medicare Mentor, and I want to help you understand something that could completely change the financial future of your family. Every year, millions of older Americans assume that Medicare will protect them from the high cost of medical care in their final years. It's a reasonable assumption. After all, Medicare is supposed to be there when we need it the most. But the reality is far more complicated than most seniors realize, and that gap in understanding is exactly what puts their life savings at risk. I want you to imagine this scenario. You're a few years into retirement. You're healthy, you're careful, you budget well, you have Medicare, maybe a supplemental plan, maybe a Medicare Advantage plan. Everything feels secure, but then you find yourself in the hospital in a way you didn't expect. Maybe it's a fall, maybe a sudden illness, maybe a surgery that turned into a longer stay than planned. The bills start to come in. One from the hospital, one from the specialist, one from outpatient rehab, one from an ambulance ride that wasn't fully covered. And before you know it, your Medicare coverage has gaps you didn't know existed. Thousands of dollars in coinsurance, daily hospital costs, or long-term care bills start appearing. Not all at once, sometimes slowly, but steadily enough to drain a savings account that took decades to build. Now imagine that continuing for years. Imagine a long-term illness or a chronic condition that slowly requires more care than Medicare is designed to pay for. Imagine needing skilled nursing or long-term custodial care, something Medicare barely covers at all. In those moments, a lifetime of savings simply evaporates, and many families don't realize what's happening until the inheritance they planned on leaving has already disappeared. This is the part of Medicare no one talks about. Not the enrollment deadlines, not the premiums, not the benefits, but the financial exposure, the holes that medical bills slip through, and the way those holes can swallow up everything you worked so hard to leave behind. And it's why estate planning and Medicare planning should never be treated as separate things. They are deeply connected, and understanding that connection is the difference between preserving your legacy and watching it vanish. One of the biggest misconceptions that seniors have is believing that Medicare covers long-term care. It doesn't. Medicare covers skilled nursing only for a limited period and only under specific conditions. It does not cover custodial care, the kind of care someone needs when they need help with bathing, dressing, eating, or simply moving around. This type of care is one of the top reasons seniors lose everything, because the cost can easily reach $8,000 to $10,000 a month depending on where you live. Most families cannot sustain that for long. And unless you've built the right plan in advance, your savings and assets will be spent down until there is nothing left. Estate planning isn't just about wills and trusts. It's about protecting the things you've built. It's about making sure that unexpected medical expenses don't force your family into making desperate decisions. It's about ensuring that your home stays in your family, that your savings doesn't disappear, and that your care can be managed without draining every last dollar you have. Before we go deeper, let me pause for a moment because what I'm about to share next is something every family needs to hear. If you've been finding this information helpful so far, make sure you subscribe to Medicare Mentor so you don't miss future videos that could save you or your loved ones thousands of dollars and years of stress. This channel is here to empower seniors and their families with the knowledge they were never given. Now let's continue. One of the most overlooked tools in protecting your legacy is understanding what's actually at risk. Most seniors overestimate how much Medicare will cover and underestimate how much exposure they still have. For example, Medicare Part A covers hospital stays, but after a certain number of days, the daily costs escalate dramatically. Medicare Part B covers doctor visits and outpatient services, but there is no out-of-pocket maximum unless you have additional coverage. That means in a difficult year, your costs can be far higher than you expect. And then there's the fact that Part A does not cover long-term custodial care at all, And Part B does not cover most in-home care unless it's medically necessary and prescribed. These are the types of expenses that drain estates. Not all at once, but slowly, like a leak in the roof you didn't notice until half the foundation was gone. This is why combining Medicare planning with estate planning is absolutely essential. It's not enough to choose a Medicare plan. You need to understand how that plan interacts with your financial life. You need to understand the difference between protecting your health and protecting your wealth. A good Medicare plan can reduce your exposure, but it cannot eliminate it completely. That's where estate planning steps in. Many seniors think estate planning is only for the wealthy, but it's actually the opposite. Estate planning is for anyone who wants to make sure their money goes to the people they love, not to medical bills they never saw coming. A simple will is not enough. A strong estate plan should consider medical risk, nursing home exposure, potential Medicare gaps, and what would happen if you became unable to make decisions for yourself. One of the most powerful tools for protecting your legacy is the use of trust, but here's where people get confused. Not every trust protects your assets from medical expenses. Not every trust helps you qualify for government assistance if you need long-term care in the future. And not every trust is safe from being counted by Medicaid in the event of a spend down. The timing, the structure, and the purpose of the trust matters. This is where seniors often make their biggest mistake. They wait too long. They don't think they'll ever need long-term care. They assume their health will stay stable forever. They believe Medicare will be enough. Then a sudden illness strikes, or a spouse becomes disabled, and suddenly the need for long-term planning is immediate. But by then, certain options are no longer available because of the 5-year look-back rule for asset transfers. That's why planning early isn't just smart, it's essential. Now let's talk about something many families don't consider: how medical bills can impact not just your savings, but your home. In many states, Medicaid has estate recovery programs that can come after your home after you pass away if Medicaid paid for your long-term care. That means your children may not inherit the home you intended to pass down. They may lose the property completely because of unpaid care bills. This is one of the most heartbreaking situations families face, and it happens quietly, legally, and completely avoidably if planning isn't done early. Another piece of this puzzle is understanding how your Medicare choices today affect your estate later. For example, the difference between original Medicare with a Medigap plan versus a Medicare Advantage plan can drastically affect your financial exposure. Advantage plans can limit your annual out-of-pocket costs, but they may come with network restrictions or require pre-approvals that could complicate care. Medigap plans give more predictable costs but higher premiums. The right choice isn't the same for everyone, but making the wrong choice can lead to thousands of dollars in unexpected bills down the road. Those bills come from the same money you plan to leave behind. This is why I always tell seniors that Medicare decisions should never be made in isolation. They should be part of a broader plan, a plan that protects both your health and your legacy. A plan that ensures your medical needs won't destroy the future you want for your family. When Medicare planning and estate planning work together, the result is stability, protection, and peace of mind. Let's talk about another overlooked element: communication. Many seniors don't tell their children how they plan to handle medical expenses, estate protection, or what happens if they become unable to make decisions. This silence leads to confusion, mistakes, and financial loss. Families must talk openly about these issues. Children need to know what their parents want. They need to know how to help. They need to understand the difference between Medicare coverage, long-term care expenses, and the estate plan that exists to protect what's left. The truth is that medical bills don't just affect seniors, they affect entire families. A poorly planned medical situation can force children into financial stress, rushed decisions, or unexpected caregiving roles. But when there's a plan in place, everything becomes smoother. Decisions become easier. Care becomes more predictable, and the legacy you've built remains intact. If you're still with me, that tells me something important. It tells me you care not just about your health today, but about what you leave behind tomorrow. And that means you are already ahead of most people. Most seniors never think about estate planning until they're forced to. And by then, it's too late to make certain choices and protect what truly matters. So here's my message to you: don't wait. Learn your Medicare options. understand your financial exposure. Build a plan that protects your home, your savings, and the people you love most. Because the worst legacy you can leave is a pile of medical debt and a family unsure how to move forward. But the best legacy you can leave is clarity, stability, and the gift of knowing you planned ahead. If you found this video helpful, take a moment to subscribe to Medicare Mentor so you never miss the information that could protect your future. Your legacy deserves to be protected, your family deserves to be secure, and you deserve peace of mind in the years ahead.